Look at the typical exam pattern: a long page of clinical history, a confusing rhythm strip, and a four option that look exactly the same. Under intense exam pressure, this is where panic starts in, and you waste 3 minutes reading the same long sentence twice. Stop doing that. Welcome back to Increment, where we slice through the clinical clutters. Today we are going to completely reverse engineering the NEET PG ECG question. By the end of this short video, you won't need to be a cardiologist to lock these marks. You just need to follow 3 simple paper filters. Let's break it down. Whenever you see a ECG on the exam paper, completely ignore the complex 60 lines first. Go straight to the paper stripe and ask these 3 exact questions in this specific order. Filter number 1. Is it fast or slow? This is your rate. Look at the distance between the tall R waves spikes. If they are bunched closely together, it is tachycardia. If they are miles apart, it is bradycardia. This single check instantly eliminates half of your incorrect options in split seconds. Filter number 2. Is it organized or chaos? Look at the spacing between the two R waves across the entire strip. Is it predictable? If the distance changes completely randomly from the beat to beat, it is irregular. Your brain should immediately scream one diagnosis. I know, atrial fibrillation. Filter number 3. Where is the P wave? Look right before the tall QRS spike. If you see a neat small bump, it is normal sinus source. But if the P wave is completely absent or replaced by a jagged baseline that looks exactly like a sawtooth pattern, that is your classic atrial flutter. Before we do our live demo, memorize these 3 classic high-yielded exam traps that shows up year after year. Trap number 1. An elderly patient with a history of palpitation who shows up with a irregular pulse. That is atrial fibrillation until proven otherwise. Trap number 2 is a critical medical emergency. A diabetic patient with crushing chest pain radiating to the left arm. If the ECG baseline lifts drastically off the ground, it is create tombstone appearance of a STEMI. Your immediate next will be the emergency reperfusion. Do not delay this. Trap number 3. A 19-year-old athlete who suddenly collapses right on the football field. The history gives you away. HOCM. Now let's look at how much test they give you just to confuse you. Watch this. Scenario 1 gives you a long history of smoking, hypertension, normal JVP, unclear lung field. Then it mentions a pulse that is completely irregular. Watch this. We are going to take our red pen and completely cross out the smoking, cross out the hypertension, cross out the JVP, unclear lungs. They are just background noises. We circle completely irregular. It matches our filter, right? Diagnosis will be the atrial fibrillation. The answer is very simple. Rate control with the beta blocker. Scenario number 2 describes a patient with crushing chest pain radiating to her left arm and ST elevation. Again, let's slice the clutter. Focus strictly on the core anchor. This is a STEMI. Next step will be the immediate primary PCI. You just saved 2 minutes of your exam time. See, when you filter out the noises, the question solves completely itself. Now it's your turn to test the system. If an exam question shows an ECG with a shifting ribbon-like twisting right around the baseline, what is the diagnosis? Drop your answer in the comment section. If you want us to keep simplifying high-yield medical exam trap just like this on the paper, make sure hit the subscribe button. This is Increment, keeping it clean, keeping it simple, and I will see you in the next video. Bye bye.